everybody. I'm Sunil Bhandari, a part of RPSG Cross Synergy. It gives us great pleasure to welcome you to another session of the ongoing series on the pandemic. We are now entering the third year of this unending affliction. Much has changed, but just when we thought we knew the trajectory of how it was all evolving, we found new variants coming into play. Last year, we had the pleasure of engaging with Dr. Tanvir Reza, who had very lucidly bursted a number of myths around COVID and had given wonderfully practical tips on how to be safe in our office, the kind of masks we should wear, etc., etc. We thought it would be great to invite him again to clarify some of the recurring doubts of the new variants at play and how we should keep ourselves safe. To quickly introduce Dr. Tanvir Reza, though he requires none for this audience, Dr. Tanvir Reza is one of the leading practicing pulmonologists of the country with 24 years of experience. He completed his MRCP from Royal College of Physicians, London. He has also done his diploma in tropical medicine and health. Dr. Reza is an experienced, skilled, and much awarded doctor in his field of specialization. Dr. Reza, welcome.
Thank you, Sunil. How are you?
Absolutely fine, and really looking forward to this conversation. So, the first question which is playing on everybody's mind: what is Omicron and how is it different from Delta?
Okay. I remember coming and talking to you guys about a year ago. Since the last time we met, a couple of things have changed and a couple of things haven't. What hasn't changed is I still have not got COVID, fortunately or unfortunately. Everybody boasts that they have COVID. Unfortunately, I can't boast it. What works for me, I'll come to later on. Also, what hasn't changed is the fact that COVID hasn't gone. It's still there with us. However, what has changed is that it's changed presently to such an extent that I really honestly can't recognize it. Almost as if a teenager suddenly became an old man and everything's changed. So whereas I was struggling with patients day and night during the months of April, May, June last year, and families were struggling to keep their beloved at home, we were finding it very difficult to get oxygen, to get hospital beds. The numbers were quite high. This time around, what's happened is possibly the numbers are double or triple of what it was during the second wave, although the official figures do not show it. Yet at the same time, on the ground, I can see that there are many more patients who have developed COVID. The new variant called the Omicron varies from the previous one, which we faced during the second wave, which was the Delta variant, in the sense that we have many more people being affected very easily. So there was a time last year when if 100% of the family members were affected, I was occasionally surprised. Now, during this variant, even if one person is spared in a family of, let's say, 8 or 10 or whatever, I would be very surprised. And if that person shows negative, I would say that's a false negative test rather than a true negative, because no one's been spared this time. The other good thing about this particular variant is I haven't had to struggle with giving oral steroids as was recommended last time to people with low oxygen. I haven't had to give oxygen at home. The number of people I've admitted so far, I can count in single digits, which is very, very encouraging. Essentially, the amount of stress which I faced along with all my patients and relatives has been much, much, much lower, nearly about what? Approximate guess would be about 10% of what we faced in the second wave. People have come to terms with the fact that, fine, we will get COVID, but it's not such a dangerous disease as it was the last time. However, I must reiterate the fact that the hospitals, especially in Kolkata, at least the private ones, are very nearly full to capacity, and getting an ICU bed in Kolkata remains a challenge. So yes, some things haven't changed, i.e., I haven't got corona yet or COVID yet. It hasn't gone away, and at the same time, some things have changed, as in it seems to be milder. Sunil.
So one of the things which we've seen happening is that a lot of people are testing themselves at home, and if they find themselves positive, they're not also reporting it because they see it as a flu which they can treat it themselves with paracetamol, etc. Would that be good strategy?
Sunil, that's not a good strategy. One, I've had stories where people have refused to test either the home antigen test or the RT-PCR lab test. Worst case scenarios, there have been doctors who have suggested don't test. I have a very close friend of mine who was seeing his own physician for a fever, sore throat. And his doctor told him, it's just, this looks like a virus. You don't have to test it. As in, he was trying to imply it's a virus, but not the coronavirus, and you don't need testing. The problem with this strategy, Sunil, is the fact that epidemiology during an epidemic is very vital for monitoring and treatment strategies. If you don't have the exact figures, exact numbers, you as an administrator in a hospital or in a state or in a government can't formulate rules for management. It's only if you have the actual numbers can an epidemiologist guide an administrator, for example, the health minister or ICMR or whoever, that yes, this is where we stand and this is what we need to do to go forward so that we can decrease the social stroke, financial stroke, physical stroke, medical stroke, emotional aftermath of this disease. In the absence of these figures, it becomes very difficult, and we become more or less like blind men, roaming around trying to find out a solution, or basically like headless chicken. So coming down to brass tacks, what we need to do is one, get yourself tested. Now, there are two ways of getting yourself tested. Some of us are fortunate enough to have kept test kits at home. And this is essentially what is happening in developed countries. For example, in the UK, my daughter, they gets free kits as she's studying. And the university gives her 2 kits a week to test by herself. As a result, what happens the moment it's triggered positive, people come to know, they isolate, they stay away from others, and it helps prevent the spread of the disease. Now, here what's happening, and this is what I've come to know via my different social media outreaches, is people are testing. Good. They are getting a positive result. Good. The next step would be to confirm it with an RT-PCR, which not everyone is doing. And lastly, what they're supposed to do, they're supposed to scan the QR code, which is there on the kit itself, and either send a picture or it gets automatically uploaded as a positive or a negative. And that gets fed to the government authorities or organizations, which triggers off definite protocols. Now, if I am
Ah.
tested positive on the antigen, but I don't upload the report, one, I am not counted as a COVID patient. So as a result, the national figures or state figures or figures from anywhere of the total population affected with COVID gets misrepresented. So I, as a citizen, it should be my duty to not only get myself confirmed if it's positive on the home kit test, but also upload the report. And this is something which not many people know, even amongst the educated middle class or upper middle class. People have been surprised when I've mentioned this. So this is one thing you must know, and this is one thing you must follow. And you must remember that if in isolation, I do not inform the authorities, and if all my, let's say, friends and relatives or colleagues don't do that either, the numbers will go down, and the government or everybody or the health authorities will feel very complacent. Whatever rules or enforcements are supposed to be in place will be removed,
Yeah, yeah.
and this disease will keep spreading. Initially,
Mm.
earlier on, I told you that it's the numbers, is the statistics, and is the actual numbers which tell us what to do or what not to do going forward. So if you don't have the actual numbers, it becomes very difficult, and it will become very difficult to bring this disease under control. Everybody thinks this is a very mild variant, it's a common flu, and nothing's going to happen. Yes, I agree, but that is to do with this particular variant. We don't know what's next in store for us. The next variant could be worse than the Delta. I don't know, you don't know. Whereas if we stop the spread of this disease right now, or at least help to stop the spread of the disease right now, we are the people who's going to be benefited. And
Yes,
essentially
yes.
we are going to be healthy. So if I
Mm.
ask you to upload the QR code, and if I ask you to get yourself tested, it's not just for others, it's for yourself too going forward.